to maybe come and sit in here. Not that corn planting is more important, but if it's the right day, it's very important. So got to feed the world, and my cows. Okay, number 5, program updates by Bernie Allen, Nutrition Program. And I can tell you, Bernie, I was over to the neighbors, and I didn't see anybody in the kitchen, but I really missed the opportunity to walk in there and tell them how much we appreciate the work that they do for the nutrition program, because I was right there. I screwed up. I should have said something, because I mean, it is really, I think, a success in Dunn County, the way we handle the nutrition program from starting out at the neighbors. So it's up to you to take her from here.
I agree.
Thank you.
It's been going well. Excuse me. Okay, well, I'll just talk today a little bit. Excuse me. Just a couple updates about what's going on with the program. One of the things that we do each winter or fall, excuse me, we pass out blizzard bags. So those are shelf stable bags of food that we receive from typically from Feed My People Food Bank. And those go out to pretty much all of our participants who are interested in having those on hand. They're kind of designed for days that maybe if we have inclement weather and we can't deliver a meal, then they could utilize that food on a day that day. Usually it's something that could be tossed in the microwave or the oven and heated up. So we distributed those already. We actually had some additional shelf stable item bags that were delivered by provided by another organization that we just recently have passed out to our participants as well. And excuse me. So, and another topic that I was going to give an update on is the Meals on Wheels America pet food grant. So we received $3,000 to provide pet food and some supplies possibly if needed to our participants. And so far we have provided pet food to 26 participants, which accounts for 16 dogs and 24 cats. So we've kind of let the individuals with the pets know what type of food they need or they've been utilizing for those pets, and then we've been able to drop off the pet food with meals or at the meal site depending on the situation. So it's going well. We still have some more funds, so that grant goes through, or the funds have to be spent by April 21st, 2024. So we continue to distribute pet food. Okay, so, and a couple other updates. I usually try to put together just a few numbers as far as what's going on with the program. Then the most recent information we have is from December of 2023, so this past month. And so I brought today just a little information about the total meals and kind of comparing them. Overall, there's a lot of similarities. We've kind of leveled out, say, since the pandemic. There's some months that are busier than others, but so I'll start out with talking about so in Ridgeland at the Dairyland Cafe in 2022, December 2022, we distributed 156 meals. And actually that site has been a little bit busier. This past year, we've had a couple more home deliveries out of the restaurant there. But anyhow, in December of 23, that accounted for 199 meals distributed. Sand Creek, excuse me, our other smaller restaurant location in Sand Creek at the cafe. In 2022, there was 33 meals. 23, there was 19 meals, so a little bit of a drop there. Our Colfax meal site in 2022, there was 408 meals, and that includes people dining at the site and also home delivery. And then in 2023, there was 511 meals. And then we have a small site at the Hosford Ridge apartment complex in Menominee here. And then last year, in 2022, there's 167 meals total. And then this past December, there was 193. And then finally, our largest site here in Menominee at the Tantera apartment complex, where we have some dine-in and some individuals that reside right there at the apartment, but the bulk of that is home delivered. So in 2022, it was 1,632 meals. And then for the 2023, we distributed 1,699 meals. So, and then for totals, the total month of December in 2022, it was 2,396. And then for this past December 2023, 2,621. So a couple hundred more, but then I guess you can kind of see the trends there. They're pretty consistent with Menominee and at the Tantera apartment complex being our busiest site, of course, because we have all of our big routes out of that site. So a couple other things. Last time when we met back in September, we were planning for a in-person training, a day-long training, and that occurred in Eau Claire. And we had most of our staff able to attend that, and that went really well. The staff agreed that the topics were relevant. We had some pretty good speakers too, so they liked that. We had a nice lunch, and they had some door prizes. And the plan going forward, at least in our region, is to try to do that once every year. Have a big in-person training. And we, of course, throughout the year, do some other smaller things, or I'll sometimes send out an online training for staff to view, but this gives people a day to socialize and also to hit on some of those bigger important topics. And then lastly, kind of something I always bring up, we have been fortunate. Just recently, we've added a couple more volunteer drivers. We continue to always look for additional drivers, of course, especially in the winter months, because we have some that are, some of our drivers are, or most are retired, and some head south for a month or two in the winter. So, but luckily we've been able to, actually just today I was training with a new volunteer on the route. So that's been good. Yeah. So, any questions on any of those, that information?
And a blizzard bag, just out of curiosity, are there more than one? I know you can't differentiate exactly how many entrees, but how big is it?
It varies year to year. This year, the Feed My People, it was kind of more, I guess you could say, almost professionally packed, but it had like 3 or 4 beverages, a couple, maybe 2 entrees, and then some sides. And then the others that we received had quite a few different things in there. Some had cereal or breakfast bars. So
Great.
there can be some variation, and like I said, some people who, just don't care for it, and they say, no, thank you. But we have quite a few people that do want those to have on hand, especially for the
Right.
people that get out, rarely. So it's a nice thing to have. Yeah.
And with no snow this winter, they're probably still all gone. but-
Yeah, knock on wood. Yeah, so far we have not. I mean, we haven't. Last year there was a few days at least where we had to cancel. So our program, if the Menominee School District closes schools, then we don't deliver meals. And if it's a day they're not in school, like on Christmas break, if it's bad enough, so last year that happened a few times. So far this year we haven't. We've had, like last week, we had not the best weather for delivery, but we still were out and about. So yeah, so luckily this has been a pretty mild winter. But yeah, they'll still, obviously they can still, and the dates on those items are, some of it's kind of like a stew in a can or things
Right.
along that line, so it can last for a while.
Yeah, Bernie, I'd like to make a comment on the Meals on Wheels. The only one I can really address is Colfax, because my wife had the misfortune of fracturing her back right before Christmas. So now we are utilizing Meals on Wheels and friendly people. And as luck would have it, it seems like our therapy sessions are always the same time they deliver the meals. So I just leave a note, put them on the table inside, and they do that. Very nice, and the meals are good, as you can see. I haven't lost too much weight, so this committee here and also the ADRC, a lot of people don't realize what's available, what's done until you really need it, or you have a neighbor or a relative that needs it. I think the importance of this committee can't be overstated. So I just want to thank you, the cooks. Yeah, roast beef, I love it.
Eat more beef.
Yeah.
We'll make more.
It's our favorite, it's the favorite meal, that's for
Yeah.
sure, the roast beef
Can't wait
days.
4 days a week. Come on.
I have a question for you. I mean, I think the meals, we've been drivers and the meals always look so good, so that they're really good. My question has to do with there's 4 churches in town that provide evening meals. And provide meals that are out of the churches. Do you coordinate with them at all, or do you communicate with them and because uh, people pick up the meals in most cases
Right.
and take them home. And sometimes there are people that are coming from other counties even and other communities that pick up the meals and take them out. I guess I just wondering about coordination and understanding what's going on in the community as a whole, not just with the nutrition program.
Well, I wouldn't say we coordinate with them, but I'm aware of that option. So oftentimes if, I receive quite a few different phone calls with different questions, some related to food, some others. And so I do refer people to that program, mention I have the information available, or the ADRC in general has that information available. So, but our program, I wouldn't say we don't really coordinate with them, but if there's someone that's ever asking about other meal options, we certainly refer them to those different, the Monday through Thursday meals at the churches. So obviously if they have transportation. Yeah. So, yeah, it's a wonderful thing. I mean, that's why everyone says, there shouldn't really be hopefully anybody, going without food. And yeah, same thing with the, Stepping Stones. We refer people there, Stepping Stones a lot. And some of our seniors who do receive home delivered meals also receive their senior commodity boxes from Stepping Stone. So.
Okay. Thank you.
Bernie, I've heard that the meal that you offer once a month at the senior center sells out. Is that true? I mean, there are some people that want to go and they can't.
That actually is totally done by the senior center.
Okay.
Yeah. Yeah.
All right.
I can answer that for the senior center. So that is totally done through the senior center. They have to call and reserve their meals, and we only take like 150 reservations, but then we cook it, and they usually come every now and then. Somebody will want to take it home, so we do that as well. And it is at a cost though, so
And that's a fundraiser kind of for this.
it's a fundraiser for the senior center.
It sounds like it's popular to me, what I've heard. that
It's what?
It's popular.
It's popular because it's all home cooked right there in the facility. We're a licensed kitchen. So it's very good home cooked meals.
I also learned from talking to someone, I ask questions, that the attendance at the senior center in general has gone down since the pandemic, or not?
I don't think so.
Okay.
It's kind of really been back up.
Okay.
It's taken a while, but it is back up. There's a lot of programs and a lot of exercise programs are really well attended, almost too much to get in the gym. But yeah, no, it's, card groups are real popular. Like I said, we only do the meals once a month, whereas before the pandemic, we did them every week. But we won't be going back to that because we don't have cooks that are willing to do that. So,
Were the cooks volunteers?
yes, we're all volunteers. Yep.
Thank God for volunteers, I'll tell you. Bernie, question I would have would be, when you're meeting with your counterparts, to Eau Claire and Chippewa, I suppose, are your vendor lists about the same? I mean, are you Indian Head Food Service and whoever else is your main vendors, or they about the same for each county?
I think so. To be honest, it doesn't, Eau Claire County has their own kitchen, so they're purchasing their food, and then at the neighbors, Dave, he's the manager there. I think he gets some food from, Indian Head and some from Cisco. The supplies that I purchase for the program are either from Cisco, and then we have another company called Oliver that produces those containers. But of course, I'm not actually purchasing the food myself, but I don't know. I haven't, really discussed with Betsy in Eau Claire County who they purchase their food from, but Indian Head is a big one in the area. Yeah.
Yeah, well, I just happened to see one of their trucks making a delivery and I'm thinking,
Yeah.
I'm thinking, first of all, I'm glad I don't have to roll those two-wheel carts off the back of a trailer. I
That's a
see those
big job.
guys,
Yeah.
jeepers, that's a young man's job.
Yeah.
They're stacked up as high as the guy.
You'd be surprised. A lot of the drivers are not young, but anyhow, yeah. I used to work in a school district, and we ordered most everything from Indian Head. And yeah, they had some of the guys unloaded those trucks are seniors there as well. So
Wow,
yeah, it is a big job though, for
Yeah.
sure. Same thing with the milk haulers,
yeah. Oh, more milk too.
Um, you bring up an interesting question because I do wonder if there has ever been in the past a discussion about consolidation between the counties in contract negotiations with Indian Head or Reinhardt or Cisco for better prices that would be across the board for all of the recipient.
Oh.
The-
There's a lot into that. There's different buying groups and other things where you
Right.
can get in, and I'm not sure how I know. I think for the most part, a lot of the pricing is similar, but I don't know. I mean, like I said, I don't order the food anymore, so it doesn't, but I'm sure that when you have multiple vendors, then they can shop around, whether, like you said, sometimes certain vendors don't offer things in the right pack size that you need. So you have to have that flexibility, but
Right.
I'm not sure, as far as like, getting together as different nutrition programs, whether when we're kind of spread out per se. I mean, we have Eau Claire County, Dunn County, but I don't know. I guess I really haven't delved into that at all. So.
Right. Well, it was more out of curiosity that could there be a better price negotiated for the foods that are purchased?
Possibly it.
Maria, I have really strong relationships with the ADRC managers for Eau Claire and Chippewa County, and I can at least ask if there has historically been any attempt to do that and just
Right.
see. So I will do that.
Yeah, I know at school level, I mean, I worked at the university dining service and contract negotiations was always a really kingpin part of the dining service operation.
I honestly don't know if there's ever been an attempt to do that, so we can certainly check. I mean,
Yeah.
we're always looking for ways to save money if we
Yeah.
can. So, but again, there may have been an attempt in the past and I'm just not aware, so I will ask them.
Yep, thank you.
And if that food comes off the farm, harvested and planted with Case IH equipment, it's gonna be top notch, right, Luke?
Noted.
Commercial.
But we're at the end of the meeting, All the intelligent questions have been asked, so now it's time for the other ones. Anything else for Bernie? I mean, I think we've had a good discussion and I think we can all be proud of the good job that's been done and continue to being done. And undoubtedly the need is going to be there and it's not going to go away and it's not going to shrink. So we just keep on top of it and keep doing what we need to do. And when you need it, it's nice to know it's there. So Anything else on the agenda, Tracy, that we should be covering?
Not for the nutrition agenda.
Okay. Well, I can just call the meeting to a close, I believe, or
We
what?
do still have items on the ADRC agenda though, Larry. Sorry,
Oh.
the nutrition agenda is done.
Oh, yeah,
Yeah,
right.
I
I don't
have,
have to do a new,
I don't.
well,
Well,
Gary, it's,
Larry can
yeah,
leave or stay.
it's,
So we'll maybe take a motion to close the nutrition.
right, we'll do
Okay.
that. How about a motion to close the nutrition part of the meeting?
Okay.
He's moving and honest to goodness, he moves good for an old guy. Okay. Second. Okay, we're adjourned.
Thank you all for your service. I appreciate it.
Betty, are you seconding that? I see. you-
I will be happy to second it. Yes,
Okay.
thank you.
Thank you, Betty.
You bet.
Okay, Tracy, we'll move right in then
Okay.
to the Dunn County Aging Disability Resource Center Advisory Committee meeting. And do we do a roll call again, or I can look around the room and say that we have,
I've got them written in both places, so I
Okay.
think we're covered.
and then, but we do then need a motion to approve the minutes for the November 20th. Thank you. Got
That
a
was
motion here.
Dave
Dave?
motioned. Okay.
Second, Luke. So I threw a lot of dates here we got her done here.
Yep.
Any public comment then, coming up on the aging and disability from anybody? Anything been sent in or?
There is no public comment. Oh, let me just double check actually. There's something in the chat. No public comment. That's just that the recording started.
Okay,
I have a public comment.
there we go.
Okay, or a comment. I just want to announce that all of you are invited if you are wanting to come to this. There's a program going to be, the Chippewa Valley Learning and Retirement Program is going to have a program on long-term care issues here in Western Wisconsin. And we're going to have, we're looking at how the state is approaching these because we have some issues here in Western Wisconsin. And Clint Moses, our representatives, Clint Moses, Rob Sommerfeld, and Jeff Smith are going to be on a panel on March 27th at 10 o'clock at the Rossback Museum. And this is part of the CVLR programs. And I asked if I could invite the committee here because I think it's important that that we hear what our state representatives are looking at. And I know let Tracy know about this, and I just want to let you know that you're invited to come to that. If you want to, you could just sign up. Even if you're not a member, you just sign there that day on the sign-in sheet. And so I just wanted to let people know that.
March 27th.
March 27th, which is a Wednesday, before Easter, just before Easter, at 10 o'clock in the morning at the Rossback Museum. It's going to be talking about, we're asking them to address the issue of long-term care issues in Western Wisconsin. And just because we have nursing homes that are closing, we
Right.
have lack of providers that are available to do in-home kind of cares. And how is the state addressing this? And it just so happens that Clint Moses, Representative Moses, is in charge of the long-term care committee for the state. And so we really want him to address what direction that committee is looking at and where the state is going as far as dealing with some of the issues that are out there. Yeah.
And also, Humana has taken over Incusa, which is the big provider or funding agency for a lot of individuals with disabilities and so on. And I think all of us that are parents or somehow involved with loved ones that are in that program are very concerned about what changes might be taking place with Humana really getting involved, a national organization getting involved in what has previously been managed at the county level, then was privatized and is now being handled by Inclusa, but it now oversight is by Humana.
Well, one of the things that we're going to, for this format, this forum, we're going to have them talk about a little bit. Then we're going to have written questions
Yeah.
that people, and it might be helpful to have a written question written out ahead of time to address this issue that we can then ask our representatives. That would be helpful.
Margie, how would folks get those written questions? I mean, or is that the
Well-
questions will be written at the event that day?
Yeah, we're just gonna hand out cards and let people write.
Okay.
But if you have something, if you need to take a little time to compose something that would be, then just write it out on a 3x5 card or something like that. And then we'll make sure that gets it, or get it to me and I'll, make sure it gets in. No, this is really a Chippewa Valley Learning and Retirement class that's but I think that it's important enough that at least people that are involved in decision-making and dealing with aging issues need to be informed and invited, and I asked if they could. I mean, it's not really, if people come, they're not gonna be turned away.
I plan to attend, so.
Okay.
Our legislative session for county board is next month with those guys at 6:30, right? Or whatever it is. So I mean, we could have a real chance of, presenting our issues twice within a short period of time, and to pull those three together in one spot and be able to speak to them is a major undertaking.
Well, I'll tell you, it took a lot of work to get
Well,
them
I mean,
to
it's
commit.
impressive that you have, because they're usually booked, or anyway, that's what I believe them when they say they are, because, everybody's.
So when is the legislative session for the?
Next county board meeting is the third Wednesday, and they're going to be there at, I think 6 or 6:30 prior to the 7 o'clock board meeting, right?
You mean the legislators are gonna be there?
Yes.
Oh, great.
So Larry, that's in February, correct?
Yeah, that's in
Okay.
February, and this will be then a month later.
What is a month later? I'm sorry.
Her
What do you-
My program.
Oh,
Yeah.
okay.
prospect is in March, 3 days after my birthday, I'll probably be there still. Quite cheerful.
And
So if
then
you could get some information to the executive committee fairly shortly here to get it on the agenda for county board, if you want
They,
something on there for this.
well, we have a legislative from,
But your legislative stuff, the way we did it before, is executive committee set it up, who is gonna speak on what for the
oh,
legislators.
okay.
So what I'm saying.
Gary would have been, we should have kept him
Yes,
here,
too bad Gary isn't.
because he
here.
chairs that legislative group.
Yeah.
So
question.
this isn't just an open question and answer thing where we can walk in with our questions.
No,
Okay, thank you, David.
And that schedule is set. It's in our packet.
Oh, it's
For the next-
already,
for the
it's
next
already
meeting.
decided?
Yep.
Okay.
Yeah.
We're,
Executive committee already has printed what our discussion is going to be.
were press releases sent out to the newspapers in the western Wisconsin area?
No, it hasn't even been sent to the members. It goes to the members
And then,
of
okay.
Chippewa Valley Learning and Retirement, which is about 800 people. And so that will be sent out to the members in the next, probably around the 1st of February or something. So this is not something that the whole public is invited to.
Not invited, but maybe a reporter there to talk about or write about what they what they decide, their decisions, or what's going on now. They could.
Well,
lot of people-
we might ask the I will check to see if we can get the press to maybe come and record or at least write up something about it. I'm not sure that, I don't know the policy. I think I need to check to see if that's appropriate.
Okay.
So,
But they will be at the county board meeting.
The press?
No, the legislators, and the press always covers the county board meetings. And there is a time for public comment at the county board meetings. So the legislator is going to be there for Dunn County's proposals, from land and water through retirement, to these guys or these legislators, and there's a public comment. So I mean, if you had something you wanted to say after the meeting is called to order, just like here where public comment comes up, that's the same thing on county board agenda. And you state your name and your address, and you don't even have, I mean, it's on the agenda. You don't even have to speak to something that's on the agenda, do you, Dave? It's for
No,
public
you don't,
comment?
But you can, but it's not gonna be a dialogue back.
No,
and forth.
nobody
You're
talks
just
back.
gonna be able to Say what's on your mind, and
Yeah.
used to be 2-minute rule.
Yeah. So I mean, even announcing at the county board meeting that, you've got this event coming up, I don't see why that would be a problem.
Well, you could also speak to the issues and let them know that it's important in Dunn County. So they would
Right.
realize that it's important. So when they come to this next meeting in another month, that they might be prepared for some answers if you ask some questions at the meeting.
Right.
But you won't be able to have a dialogue.
No,
with
you
them.
make your statement, who you are, and say, this issue is important to me, and we've seen this happen, and that now, I mean, I used to be on the neighbors. And, uh, I mean, that's important to citizens of Dunn County in many, many ways. It isn't just that the neighbors is there to offer, a place for people to live. The neighbors need to have staff. And that's a big issue with them is, acquiring and maintaining staff. Because everybody's looking for those nurses to fill positions. And when you are, I can't think of the name of it, where you provide medical care like they do, is a whole lot different requirements than if, like, when Colfax closed and then they just are not a medical facility anymore. It's just, help people live. I mean, the neighbors can make $1 million 1 year and lose $1 million the next year. And it's all about having staff and to have the beds filled that people need to get to. I mean, it's kind of a sad state of affairs, is that if you really need a place to go, a nursing home, and you got one just across the field and they got empty beds, and they'll say to you, well, we'd like to help you out, but we don't have the staff here to do the work. So, that's a good issue that you just get in the ear of these legislators, that and the need is there by the public, and Dunn County has seen fit to have the facility. Now we need to use all of the facility, and whether they change the requirements or put more money to the nursing homes, the county nursing homes, I can't remember the number of them, but they're down to just a handful that are left, county run operations. And Like I said, I was over there this morning for a church thing, for crying out loud. I'm getting into stuff I've never gotten into in my entire life. And it's such a nice place. And I talked to that Carmen, who's the manager there, and she's just a gem of a person. And she reminds me of this one over here.
Mhm.
Knows how to get the job done and does it with a smile. And right over there. Well, he does too, but this, with a smile. Well, anyway, I'm kind of getting long-winded here, but there's opportunities that we need to do as citizens, to letting our legislators know what's important to us. And we just gave you two places where it happened. That's doesn't happen every day.
Do the legislators come every time there's
Every
a,
year, there's
oh, just once a year
once a year, there's a legislative
committee meeting
committee meeting.
with them?
And
Okay. Okay.
and there is well, here, look at this. Okay, think of this. There is a sort of a meet and greet prior to the call the meeting to order, the county board meeting. There's a half hour, and nobody's going to say, well, you can't talk to me because you're not a county board member. If you're a citizen of Dunn County and those are elected officials, they're open game to you to tell them what's important on your mind. So, you might be able to shake the hand of the guy that makes it happen.
So
Okay.
what's the answer to get more nurses in the community? I mean, that's the thing.
That's the big one. And, well, I'm certainly no expert, but I can tell you what I know about it because you asked. Often you hear about, I'll just say, I only know two young women that had like 4.0 or 3.8 grade point averages. And they are turned away from University of Wisconsin, Eau Claire, for some baloney reason. They can't get in. They want to do this. I want to do this. And that's their career choice. Many of them go to tech school and end up with a 2-year program, which I can't tell you how a 4-year is different than a 2-year, but it's different. Okay, so what can you do? Well, believe it or not, Stout does not offer nursing programs. And they'll tell you, well, we don't offer nursing programs because we don't have the staff to teach nursing programs. Well, you got parking lots and you got classrooms and you got heat and light. Why don't you go out and hire somebody? Well, because in the law, because we have a nursing program in Eau Claire and we have a nursing program in River Falls, somebody said along the line, you can't, Stout cannot have one because the adjacent community has a nursing program. Well, that might have been a good idea many years ago, but it ain't a good idea today because you need those nurses. And I don't buy their excuse that we can't hire staff to teach young people nursing programs. I don't believe that for a minute. I mean, there is a curriculum that's put together, and let's look at the nursing career. Okay, more than likely you're going to work Christmas 1 out of 3 years. You're going to be there on your wedding anniversary. You're going to be there when it's opening deer hunting, and you're not going to be off for a month at Christmas and off all summer. I mean, the opportunity, don't tell me that you can't hire people out of the nursing pool of people from places, that where they're working as nurses to be instructors at at Stout. I don't believe it. Apparently, you just don't have enough money to pull them away from the jobs that they're at. And maybe it seems far-fetched for some people to believe, but I'll just compare it to training professional truck drivers that the vocational schools do. And, you know, those best instructors are guys that have had experience on the road dealing with everything there is to deal with, teaching these new young bucks what to do. Maybe young bucks isn't the right term, but you know, they're all aggressive young guys, you know, and they want a big truck and they want to fly and they want to see the West Coast. And instructors, you know, are tired of seeing the West Coast. They're tired of running the George Washington Bridge. They're tired of being messed up in Chicago with low bridges. And yeah, I'll take your job over here at Eau Claire, and I might have made 70,000 driving all over. But if you offer me a job at $50,000 or $60,000, and you tell me there's spring break and there's Christmas time off and there's this and that, and you're not crawling underneath hanging chains to get up the mountains in the West, you can get instructors. So
I
I'm
think-
saying is they should,
I think training is one issue.
yeah.
And I think there's a lot of other issues dealing with the whole issue of, I mean, traveling nurses make a heck of a lot more money than,
Yes.
and it's much more, financially viable for them to travel someplace else. And we have traveling nurses coming into this area to work. And you have to pay them a heck of a lot more. So part of it, you know, is salary levels, training. There's a lot of things, but there's not just nurses that are needed. There's hands-on people that are willing to come into the homes and help for CNAs. There's a lot of different issues that are all centered around this. And I guess the question is, how is the state dealing with how to deal? They need to look at all these issues, and they need to look at how they can make sure that there's enough services in Western Wisconsin to deal with the population that is in this area. So, and with all the nursing homes closing down, and I don't, you know, I don't know how the program that you're providing here in the county is doing for help to provide services in the home. You know, what is happening there? Is there enough workers in the area to actually provide that service? And you know, so I think there's a lot of issues. And I think from my standpoint, when we look at legislators, we're looking at how is the state looking at helping provide some of these, and part of it is education, part of it is pay, part of it is the kind of worker that is needed in the area. Anyway, that's just my comment, so. And
Much more to the point than mine. Well,
Did you want to add something?
I just wanted to ask if this Chippewa Valley Learning and Retirement, if I would go online, is that something I could just sign up for, that I would want to be part of that?
Probably.
There's a class.
Oh, okay.
It's like $30 a year, or
Okay,
maybe $15 a semester, or something like that.
okay.
It's
Great.
cvlr.org.
CVLR.
cvlr.org.
Okay,
And you
thank
can pick up at the senior center. You can actually pick up brochures that once they're out around the beginning of February.
Yep, thank you.
Pink. Mhm. Okay, I didn't mean to take up so much time.
no, we're doing good.
Very good.
We're gonna come, let's dig into this stuff. Of course, I have no idea where we are on the
We
agenda,
are at
Tracy.
staff reports, and Bernie already gave the nutrition one, so we're on update on ILSP program, which is kind of Margie just alluded to a little bit.
Oh.
So that's mine. So that independent living supports pilot project that I've been talking about a lot, it is fully up and running. There certainly have been some snafus anytime the state starts a new program. I guess, and we signed up to be part of the pilot, which benefits is that in our 3-county area, 430 folks should be able to enroll and get those services. But the negatives about doing a pilot is that you deal with all the bumps in the road. So some of the bumps in the road is the computer program that the state that we need to utilize to get people fully enrolled and be able to check. So my staff can check to be sure that they're getting their services and how much funding has been spent for each participant, just went live last week. So even though all this has happened, it's just taken time to get those programs developed. There's a third-party administrator of the financial piece. It's called Premier Financial Services, and they're responsible with working with the vendors and getting vendors signed up to be able to provide services. And that has not been a smooth process, although it seems to be evening out. Margie, to address one of the questions you just asked in terms of finding providers for people who are in their home and would like to use some of their funding to help pay for their care, we have had some limited success with vendors in this area that have capacity and have signed up for the program, like Visiting Angels, for example. But the most successful folks in terms of being able to get services provided are actually those that maybe have friends or family that can provide those services and have been able to sign up to be a vendor through the program and provide that care just for those individuals. So for example, we have somebody who is looking to have their granddaughter be a caregiver for a grandparent so that the kids who are providing the bulk of the care get a break, get some respite, and that grandparent would really accept their granddaughter to be providing that care, and it would be tough for a stranger to come in because that grandparent has some dementia-related issues and has a lot of distrust of strangers at this point. So we've been able to do some creative things, but certainly even though there's funding available to help people get those services, that doesn't mean that we had a magical pool of providers that, that the general public doesn't have access to. So that certainly has been challenging, and working through trying to creatively find people that will provide those services for folks has been something that we've been working on. We have had some really good success stories. For example, there's a couple in Chippewa County that both of them are starting to have some more significant physical needs. They were thinking that they were going to have to move to an assisted living because of the setup of their home wasn't conducive for them to stay there much longer based on their physical needs, but the program was actually able to pay for them to get a chairlift installed in their homes so that it's like my understanding is it's a bi-level home, so it was, no matter what, they had to go up or downstairs, and now they have a way to safely get up and down those stairs, and it has just been a real blessing for them. So we've got some good success stories. We've got some good good momentum now going forward, but I don't think anything is working as quickly as everyone would like. But again, when you're part of a pilot project, those are some of the things that you have to understand. The goal of that project would be that hopefully maybe the state will get funding from the federal government to make that permanent. And then if that's a permanent project, we'll have worked out all of these kinks in advance before it expands further throughout the state. So that's always the goal for a pilot. The state did recognize that counties participating needed more support in terms of staff, because the folks that have signed up for the program have needed a lot higher levels of case management than what was anticipated. It's supposed to be very independent, the independent living support pilot, but based on the amount of paperwork and the amount of computer submissions and all that sort of thing, folks have just needed more assistance. So the state did offer more grant money to the counties involved to be able to hire on additional staff through the pilot project. And so I did write a grant to hire an additional 3 part-time folks to serve the 3 counties. And we did have interviews for those positions a week ago Friday, and one of those candidates is somebody that I'm moving forward with, and then we're probably going to repost for additionals. Again, that's fully funded by the state. There's no county levy or anything involved with those positions, and they are limited term employees just through the period of the grant. But I really was grateful that the state recognized that the needs of the folks participating in the program were much more than anticipated. So it's just taking a lot more staff time to get them fully enrolled and being able to use that program. So, but I do feel like it's still very positive. You know, it's definitely been a learning experience, but now we're finally feeling like there's good momentum moving forward, and people are starting to get that those services that they need. So, yeah.
Tracy, I have a question. You had a budget request in last year's budget, and did you just talk about what?
Sure, and that's
for?
actually the next point,
Oh,
Larry.
good.
That budget request was for
Yeah, the other side of
yes,
the page. Okay.
yes,
there,
it was
okay.
for our adult protective services worker. Just a couple updates. The county did agree to fund a new position in adult protection for a lead worker position, and they are moving forward with hiring that position. Interviews are on Wednesday, but I think I had provided kind of a lot of statistics for both you and for the Human Services Board in terms of just the overall numbers of increase in those adult protection cases. The statistics show when the first full year that statistics were really kept in adult protection was 2017, and between 2017 and last year, the amount of cases have more than doubled in terms of both referred cases and cases that have actually been opened for investigation in adult protection. Currently, there are only 2 adult protection workers, so that a lead worker will actually have a caseload and will be doing some of the protection work, but will also have some administrative duties. So very, very grateful that that position was funded. Another update, though, and I think it was something that I shared, is there has been some reorganization under the Department of Human Services umbrella, and I no longer supervise adult protection. It is now being supervised under behavioral health. There's quite a few different reasons for that, but one big reason, and one that should be positive in terms of county board numbers wise, is that there are a number of cases that come through adult protection that with their new organization, they are going to be working hand in hand with our crisis area. And many of the calls that we get could be considered crisis and are actually billable to the state Medicaid program if they're handled in the right way. And the pairing with the crisis area and getting that kind of crisis training allows for some of that time and stuff to be billed, whereas we don't have the capability to do that under the ADRC. So kind of making that move. The new supervisor for adult protection is Sarah Olinger. And for those who've been around for a long time, I actually took over supervising adult protection from Sarah. She was the previous adult protection supervisor prior to me. She actually has much more experience supervising APS than I did. So they're in very, very good hands. And are working towards kind of integrating those two, the crisis and the APS units, to be able to provide some seamless services to folks who are both adults with disabilities or elders that may also be dealing with a mental health crisis, which we frequently got calls regarding, because a lot of times situations like that really go hand in hand. So a lot of work is going into that, and they're still kind of working through the process and getting training. But in the end, I think that it'll be a really positive place for APS to land, and really positive for Dunn County too, because hopefully it will open up some billing options that were not there before. So that change happened on January 2nd, the day after so it's still relatively new, but things are going along well.
So what do you see do you see any reason for the uptick in cases, and why is there, been such an increase?
I think that it follows very closely the aging of the population. Still about 80% of the cases that we get through APS are serving elders. We also serve adults with disabilities, but about 80% traditionally have been related to elders. And obviously as the population of elders increases, we can just anticipate seeing that. The other thing that in APS, we've done a lot of work in the 2 years that I've been there, and it's continuing, is really partnering more with law enforcement and doing the, while I was supervising APS, we actually partnered with the Department of Justice in a grant to provide where APS is involved doing training with law enforcement, and that actually is going to be starting soon. So law enforcement officers have become much more aware of the services that we can provide and aware of situations when they're responding to things in the community and they see things. And before, it didn't trigger them to call us like, oh, there's a role for APS and they might actually be able to help these folks. That's happening much more frequently. So I think partnerships, I think just the aging of the population and the numbers of folks that in the APS world, an elder is considered anyone who's 60 and older. So that the numbers of folks even in from 2017 until now has really increased, that we would open cases because they fit that elder category.
I recently read a statistic that the suicide of men, especially older men, has risen. So on this 80% of the elders, what do you see as far as male and female?
That's a really, I've never broken the statistics down that way, but that would be very interesting. When I was supervising APS, I screened all of the reports that came in and I made the decision about if it was being opened for an investigation and who it would be assigned to. Just speaking off the top of my head, I would say it's fairly even, probably skewing a little bit more towards more females, just because, especially as the females live longer than men. That's still longevity wise, but fairly even. But I've never actually broken it down that way. So that would be really interesting to have that data.
As usual, I'm learning a lot.
There's a lot to learn, that's for sure.
Really.
Just a bit of breaking news though, when we're talking about those shortages in medical care and long-term care. As we were sitting in this meeting, I got an alert on my phone, and Chris pointed out to me too, that the Hospital Sisters Health System has announced today that it is closing both Sacred Heart Hospital and St. Joseph's in Chippewa. And all Prevea locations in western Wisconsin are closing. Yeah. So when we're talking about shortages of healthcare, that's really astounding
Well, look,
and very worrisome.
look what happened with Marshville too.
Yes.
Right.
And they're cutting out of letting quite a few, what is it, 30% of the staff go? Quite a few of the staff going there too. And their main,
Office staff that they're
mostly,
dropping.
probably middle management, maybe.
Yeah.
Yeah.
But that's really very concerning. And we deal already in the ADRC with lots of calls about folks not being able to get the care that they need quickly. And can we help, or, can we intervene? And we don't really have any power to do that. But, like we can't call and say, oh, we have a special connection. Can we get this person in to see this specialist sooner? But that's really not good news for this area. So,
There's another item for our legislators.
right.
Well, we need to carefully form some and get information enough so that we can ask an intelligent question and with information. But that, I mean, even with Mayo, you go to make an appointment and it may be 3 or 4 or 5 months before you can even get in, even if you have an issue that is presenting itself.
Experience, you go to the ER or urgent care, well, go see your primary care physician in 3 days.
Yeah.
And every time I've seen, You make the appointment, I'll gladly show up.
Right.
I tried to make an appointment with Mayo a couple of weeks ago for a dermatologist because I don't want to travel to Eau Claire anymore. And after asking me several questions, she said, no, we have no appointments available.
Mhm.
Well,
They
those-
just decided, I think, Medicare or whatever, that we don't want you. Really. I think that's happening a lot. They want to make more money if you're have an insurance provider, that where they get more money. And
Well,
that,
I'm really concerned about the Provera. Because, I mean, they're one of the major providers in in Western Wisconsin.
Mhm.
The other thing
So-
we have to be aware of is the pharmacies. One up on Pine and Broadway, North Menominee, they were without pharmacists.
Right.
There's a lot.
They were 800
Pharmacists shortage.
prescriptions behind
where is this?
Walgreens.
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 They what happened?
Pharmacists, they can't keep pharmacists.
Well,
I-
now their hours are so limited.
Yeah, and
And they
I called,
work them to death.
and I called them to, called corporate and they said, well, maybe you should go find another pharmacy because every time I would call in for a prescription, we're waiting on insurance, we're waiting on insurance. Well, it was Trulicity. I called Red Cedar at Mayo. Got it within 2 hours.
So Tracy, I have a question. So that we're not out there in the community repeating things and getting it wrong, could you email all of us, that alert?
Oh, sure. Yep, it's actually, I'm sure it will be, this is from TV 13 and Mayo has, or I'm sorry, that there's a press release from both Prevea and,
Okay.
but I can try to get that forwarded.
Can you just repeat that headline?
It says, Hospital Sisters Health System announced today that it will close HSHS Sacred Heart Hospital in Eau Claire and HSHS St. Joseph's Hospital in Chippewa Falls as a part of a complete exit from the Western Wisconsin region. Prevea Health, a physician network offering primary and specialty care, will also close all its locations across Western Wisconsin.
So does that mean lacrosse also?
I don't think La Crosse is considered Western Wisconsin. I don't know. I mean, yeah, it says Western Wisconsin's Chippewa Valley.
Yeah.
I believe HSHS in Chippewa Falls is,
St. Joseph.
St. Joseph's, but
Mhm.
aren't they the ones that handle the psychiatric ward too?
Sacred Heart
I'm thinking that.
as one of the
Because
largest.
I mean, that's been a big issue with Dunn County.
My brain didn't even, we utilize them frequently for emergency crisis
Right.
situations for mental health.
Because, one person came one time to Health and Human Services and everything was being, you had to go down to Trempealeau or across the state.
That'll be the case
And the
again.
guy said, well, if you don't have a medical problem when you leave, by the time you go with your hands behind your back and for 5 hours across the state, you'll probably have some issues when you get there.
Isn't the Sacred Heart where the Bridge to Hope sends their victims of sexual assault to?
Yes, because that's where the SANE nurses are located, sexual assault nurse examiners.
Good.
Well, that
So-
brings up, if there's not going to be things available in Western Wisconsin, it's a lot closer to go to Minneapolis and Minnesota than it is down to Madison. And I know that the state does not have, dealing with mental health issues anyway, doesn't have a relationship that they can use that. I mean, so I'm looking at our legislators again too, that they may need to work with something
Right.
dealing with Minnesota to be able to provide closer service than
It's
going down to
really-
Madison.
It's really tough, even in crisis situations, talking about like placement at Sacred Heart, like you folks are mentioning. it would be nice if it was easier to do those sorts of transfers across state lines in situations like this when we're so much closer. But that legally is a very difficult territory. But again, those are some of the things that legislators need to look at, I think. So sorry to be the bearer of what feels like really bad news to end our meeting, but again, I definitely anticipate that this is going to affect a lot of people. And like I said, we already get a lot of questions in the ADRC world about healthcare and access and all those sorts of things. So I think that's only going to increase.
Okay. Any other program updates or things to do? That we've covered plenty.
No actions on this one, Larry.
Anybody else have anything? Or we'll just call the meeting adjourned and we'll see you hopefully when I'm not planting corn in May. May 20th, right? No, not March 18th. Right. Sorry about that. That's the other meeting. Oh, boy,
Larry, can we get a motion to
I'll have
adjourn?
a motion to
I'll
adjourn.
make a motion.
Sherry.
Okay. Okay. All
Thank
right.
you, everybody.
Thank you.
Thank you.
Thanks. I'm going to end the meeting now.